Coming soon to a classroom near you from the students who brought you Nursing 6240, commentary comes an exciting new idea in health management. Comes managing health in a mobile society. Critics have been predicting this new technology for some time. Many believe mobile health is the standard of the future. The use of cell phones has dramatically increased over the years. In today's society, there are few Americans that go a day without their cell phones. 90% of all Americans own a cell phone, and 64% of Americans specifically own a smartphone. Of the 64% of Americans who own smartphones, 7% are smartphone dependent, meaning their cell phones is their only means to access the internet. The 7% of Americans who are completely smartphone dependent mostly consist of young adults, non-whites, those with low educational attainment levels, and lower income Americans. Because these Americans rely so heavily on their cell phones, it is likely they would use mobile resources to assist them with obtaining additional resources beneficial to their life and health benefits. Today's cell phone has the capability of taking the place of phone calls, snail mail, desktops, maps, navigational systems, and so much more. Studies have shown that while text messaging is the #1 thing Americans use their cell phones for, 60% of cell phone users use their phones to access the internet, 50% use their phones to download apps, and 49% use their cell phones to get directions, recommendation, or other location-based information. Smartphone users of all different household incomes use their cell phone to navigate through numerous lifetime events and important circumstances. More than half of all cell phone users have used their device to seek health information and online banking. It is, however, more likely for the low-income smartphone users to use their phones for job-seeking information and applications. Cell phone use is a great opportunity for the healthcare industry. There is such a widespread use of cell phones all over the world, and the technology keeps getting better. People have a tendency to carry their phones with them everywhere and have a strong attachment to their mobile devices. People will continue to advance in this personalization, and the healthcare market needs to take advantage of this. Use of technology in healthcare has increased tremendously, with email and social media sources now being used as channels to enhance communication between patients and their healthcare providers. And this information at our fingertips with the World Wide Web, the vast majority of the population now relies on internet services to access health information. Through advancement of technology, individuals are now given more control of their own health and immunization information using mobile devices. This has improved timeliness and accuracy of health data. We can now receive health information reminders on our phones through text messages, which has increased patient accountability and compliance. Practitioners can embrace technology to stay connected with their patients in order to be a patient's preferred provider and provide patients with real-time health education and promotion materials. One app that is currently available is called the Personal Health Intervention Toolkit. This app targets personal self-help research on mobile devices and includes standardized instruments such as the Alcohol Use Disorder Identification Test, Patient Health Questionnaire 8, and Post-Traumatic Stress Disorder Checklist, just as a few examples. This app is tailored toward data collection instruments and related patient interventions. While this app does a wonderful job giving the public tools to use in order to identify potential problems and providing possible intervention, it is lacking in other areas of wellness, including nutrition, fitness, and other preventative measures. Using mobile apps as a way to increase health promotion. Here are just some examples of what is currently on the market. Who needs help? What population is frequently searching for food, shelter, jobs, and etc.? Who suffers from health risks that may be unaware of due to lack of education and resources. Because the underprivileged are less likely to have direct access to life-sustaining resources such as healthcare, food, and shelter, it would be beneficial to have a resource they could count on to find such things. Studies have shown that the underprivileged whom we are targeting rely on their cell phones to find information about health, jobs, and locations of needed resources. What if there was a way we could provide all this information to this population with just one click? According to research, majority of people in lower income bracket do not have access to the internet, making it difficult to research jobs, healthcare advice, and more. By taking the idea of using the street card, which is filled with information on shelters, meals, healthcare, employment, and more, which can be found on Columbus Coalition for the Homeless website, and making this available to all through their cell phone will easily put this valuable information in the hands of those who need it. Taking advantage of the statistics showing the wide use of smartphones and even those whom are poor and homeless, we can put all the needed resources for these individuals at the tip of their fingers in one interactive app. Introducing Mobile U. Mobile U is a new and exciting approach to delivering resources and essential information to the underprivileged population in Columbus. Gathering information in a free, user-friendly app, Mobile U presents users with access to Columbus's available, cost-effective options for getting healthy and staying healthy, including information on available healthy food options, free or affordable healthcare opportunities, and events encouraging physical activity. Mobile U answers a growing public health need for the people of Central Ohio. Not only will an app like this allow many people to stay connected with the community resources, it can also be used as a tool for preventative health. Mobile U presents users with menus that are easy to access and see. With information available at your fingertips, Mobile U gives users opportunities to seek out and access resources aimed toward health promotion and disease prevention. Fast, easy, and discreet, Mobile U keeps users updated about new opportunities and resources available to the public without the need to reach out to the community resources, social workers, or other specialists. Mobile U presents a confidential alternative to existing programs and allows users to investigate available health programs while preserving personal dignity. Using existing Google Maps technology, Mobile U lets users find close available resources and navigate to their destination on foot, bicycle, or by automobile. With links to public transportation options, users can quickly determine distance and cost for accessing their much-needed resources. Please stay tuned for a live demonstration of Mobile U.